Autism is a spectrum of developmental disorders which include three main types, and two that are more rare: Asperger syndrome, pervasive developmental disorder, autistic disorder, Rett syndrome, childhood disintegrative disorder. Autism spectrum disorders, ASD, affect 1 in 91 children in the United States. ASD are characterized by a variety of symptoms which include decreased verbal skills, insistence to routines and social withdrawal, behavior problems, repetitive behaviors, unusual responses to sensory stimuli such as touch, smell, vision, hearing, taste. Many theories regarding the potential causes of ASD have been proposed over the years, but there is still no clear answer as to what causes ASD. However, it is important that parents bring their child to a doctor if they suspect ASD and their child. The earlier ASD are detected, the earlier treatment can start, which is essential because language and social skills as well as other symptoms can improve with early treatment. Taking care of someone who is diagnosed with ASD is usually expensive and requires full commitment to the patient until he/she gets better. The government runs various therapies such as speech, occupational, and physical therapies that help a patient get better and improve language and social skills. These therapies are costly and the government usually spends $3.2 million to take care of an autistic person in order to pay for necessary treatment over his or her lifespan. That's an enormous amount of money. Therefore, various research institutes have been running research programs to find out the primary cause of ASD. This work will enable scientists to treat the primary cause of ASD and maybe even eliminate autism spectrum disorders. We would like to expand more on one of the possible causes that is believed to cause ASD. The recent years research had been conducted to connect the gut microflora with ASD. The Journal of Medical Microbiology and its authors describe one of the potential symptoms that autistic children experience in their article called Differences between the gut microflora of children with autistic spectrum disorders and that of healthy children. The authors of this article put together several different experiments in order to find out the differences between the gut microflora of children with ASD and healthy children. The studies were done because many autistic children were reported to have gastrointestinal problems which included abdominal pain, constipation, diarrhea, and bloating. The studies reported that more than 91% of ASD children suffered from gastrointestinal disorders, with diarrhea being the most common symptom 75%, followed by the excess wine 55%, abdominal pain 47%, constipation 45%, and abnormal feces 43%. None of healthy children were reported to have any abnormalities. The same study had shown significant differences in gut microflora between children with ASD and healthy children. Analyses of fecal microflora revealed that kids with ASD had higher level of Clostridium histolyticum. Higher concentration of C. histolyticum in human body is dangerous because it can cause the death of specific area tissue. Determine the accurate numbers of predominant gut microflora. Modern molecular techniques were used, one of them being fluorescence in situ hybridization. The FISH technique was used to evaluate the gut microflora of both patients with ASD and healthy children. However, the same studies stated that microfloral imbalance in patients with ASD might be caused by the use of extensive broad-spectrum antibiotic treatment for more than 6 courses to treat respiratory tract disorders and their infections. The commonly used antibiotics were erythromycin and amoxicillin, which probably killed the good bacteria and it created a positive environment for C. histolyticum to grow in. Another research article on ASD called Gastrointestinal Flora and Gastrointestinal Status in Children with Autism: Comparison to Typical Children and Correlation with Autism Severity reported an experiment that was conducted in a similar way. 137 children with ASD were chosen to participate in this research. 24% of those had a history of at least one gastrointestinal symptom. The study found that 70% of children with ASD had gastrointestinal symptoms, compared to 24% in healthy children. Gastrointestinal abnormalities included abdominal pain, constipation, and diarrhea. This study of microbial gut flora shows quite different results and potential causes. Population-based studies were used in this research. If these symptoms go untreated, they may lead to diarrhea, which can cause severe discomfort, decreased ability to concentrate on tasks, behavior problems, and possibly aggression. The possible cause of gastrointestinal problems still remains unclear, but may be caused by antibiotics which alter gut flora. Common antibiotics demolishes all of the normal gut flora. Both studies have found that there are certain differences in numbers of C. histolyticum and Ruminicoccus between patients with ASD and normal children. High levels of these bacteria may be one of the causes which cause the symptoms that I have just mentioned in children with ASD. Clostridia are known for its toxin production. Having high levels of Clostridia means toxic products can worsen behavioral symptoms and may cause gut dysfunction in children with ASD. To determine if gut flora will improve under the antibiotic treatment, antibiotic vancomycin was used in the second study. The main reason of why vancomycin was used in this study is because, if it is taken orally, it will not be absorbed by the body. Instead, it will be sent to the intestines and kill bacteria that causes various symptoms in patients with ASD. The results were astonishing. Not only did the gut flora improve in children with ASD, but positive changes in their behavior were observed too. However, once vancomycin treatment was stopped, ASD patients no longer displayed the positive behavior changes. This proved antibiotics given to patients with ASD to treat respiratory and air infections caused an abnormal flora. Having normal gut microflora is important to the whole organism, because antibiotics like erythromycin and amoxicillin kill the normal microflora in the organism, which leads to dysfunctions in the breakdown of plant polysaccharides, maintaining water balance, producing certain vitamins, and not allowing pathogenic bacteria to grow inside the gut. In this case, the normal microflora being impaired led to the overgrowth of pathogenic bacteria. This is why some doctors recommend eating yogurt that contains probiotic, in order to normalize normal gut microflora. Probiotics are living non-pathogenic bacteria which positively affect the host's health when it is taken in adequate amounts as food ingredient or supplement. Probiotic consists of lactic acid-producing bacteria, such as lactobacilli and bifidobacteria. Research on probiotics suggests that they are effective in a wide variety of health problems. Most importantly, they can alleviate the symptoms that kids with ASD experienced in the two studies described previously. This study on probiotics suggests that probiotics have been proven to be useful for maintaining or restoring the normal function of gut flora in children with ASD. Probiotics have been shown to successfully inhibit the growth of Clostridium species. In the two studies described before, I have talked about kids with ASD having higher levels of Clostridium. Probiotics might help them improve the symptoms that bacteria causes by inhibiting their growth. Probiotics do look like one of the possible treatments that could be used to treat gastrointestinal symptoms in children with ASD.